time for On Point, where we speak to experts to delve deeper into some of the key issues in the spotlight right now. Now, daily COVID-19 numbers are down, and most importantly, the number of critically ill patients are down as well. But despite the decline, we now have a new concern, which is monkeypox.
That's right, and with South Korea also reporting its very first case of monkeypox just last week. How worried should we be? To find out, we connect with Ben Cowling, Chair Professor of Epidemiology at the University of Hong Kong. Good morning to you, Professor.
Good morning.
So first and foremost, let's kind of start things off with the COVID-19 related issues, as we always do. Again, just like Soo-young mentioned, number of critically ill patients are down significantly compared to the height of the Omicron wave. Are the treatments working better right now, or is Omicron that much less severe compared to some of the other variants?
Well, we know COVID cases go up and down over time. At the moment, they're down. I'm sure they will be up again in the future. Maybe BA.5 will find its way into South Korea at some point sooner or later. But now I think it's good that the numbers are low, and it shows the vaccines are working. And also, you mentioned drugs. Antiviral drugs do work very well. They're mostly used to treat more severe cases or to prevent severe disease. So we've got vaccines that work. We've got antivirals that work. I don't think COVID's going to pose as much of a threat in the future, but there may well be rises again in case numbers maybe later this year.
And while there's rising concern, Professor, about waning immunity for those who have been infected by COVID-19 earlier on or were vaccinated more than 6 months ago, and well, what does the data tell us really about how immunity lasts and how long immunity lasts rather, and if you've been infected and if you've been vaccinated?
Yeah, there's two reasons why protection seems to decline over time. One reason is because inside our own bodies, the level of protection that we have got from our vaccinations or infections in the past, that tends to slowly decrease over time for various reasons. The other, though, the main reason why immunity tends to go down is that the virus is changing. And that's the reason why we see reinfections from time to time, including infections in people who got vaccinated some time ago, because the virus has changed to a new strain. And so we don't have so much protection against that new strain anymore. I don't think it's anything very surprising. It happens with other respiratory viruses like flu from time to time. We know that we can get these viruses again and again over the course of our life, but it shouldn't be too frequently. So I don't think there's a major concern about waning per se. We still have the protection against severe disease that we get from our vaccinations and we get for our infections. So what we'll see as a result in the community is just cycles of epidemics and infections in the community, which are mostly mild in the future.
Let's delve into the monkeypox issue right now. At least according to the WHO, it's not a global concern at this moment, but we also here in South Korea report the very first case of the virus. How severe are the symptoms of monkeypox, and also how is this being treated at the same time?
Well, so far outside of Africa, I think there's been more than 1,000, maybe even 2,000 cases reported in all different parts of the world. There haven't been any deaths reported yet outside Africa. We know that it's, in general, a very mild infection with a rash, maybe some other symptoms of a viral infection like fever and fatigue and so on. It's not going to spread explosively like COVID, but it will spread if it's not stopped. And I think the priority for maybe the CDC in Korea is to find the cases and to isolate them and to trace their contacts and quarantine those and keep an eye on it. It's not going to pose a major public health threat. It spreads slowly, but it will spread if it's not kind of stopped by public health interventions.
And Professor, well, can monkeypox only spread through skin-to-skin contact, or can it be spread through surfaces if an infected person touches a surface of an item or whatever space there is, and a non-infected person goes and touches that as well?
It seems like the main pathway for transmission is prolonged close contact, skin-to-skin contact particularly, with someone who's already got the rash. And that makes them contagious because of the virus in the surface of their skin. But actually, there's still a lot of uncertainties about monkeypox. There have been cases for years in Africa, but it hadn't been studied that carefully in Africa for various reasons, unfortunately. And now that it's in the rest of the world, there's a lot of interest. And I think we're going to see a lot more knowledge becoming available on monkeypox in the coming weeks as there's more and more studies done of cases in different parts of the world. So that's the questions that you asked are still questions that many people around the world are also trying to find out the answers to.
Well, I mean, luckily, I mean, you should be sanitizing your hands and washing your hands anyways, as we're still in the COVID-19 pandemic, and where I'm sure a lot of us are still used to that as well. Professor, again, thank you very much for your insights, and we're always looking forward to speaking to you again.
All right, thank you.